What does pelvic organ prolapse feel like, and how do you know whether or not you have pelvic organ prolapse? Hi everyone, Dr. Nabila Noor. Pelvic organ prolapse is something that I treat in my office all the time. Essentially, what it is, it's a vaginal hernia. Because of the weakness of your pelvic floor support structures, your pelvic organs, which could be the uterus, the bladder, the rectum, the intestines, all are trying to push through the vaginal canal. But unless the prolapse is significant, we stage prolapse from stage 1 to stage 4. So stage 4 is when pretty much everything is outside the body. So unless it's a very significant prolapse, you may or may not actually physically see it. So how do you know whether or not you have pelvic organ prolapse? So today I'm going to give you 3 signs that might suggest that you should probably check in with your doctor to see whether or not you have pelvic organ prolapse. Number 1, and probably the most common, is the feeling of vaginal pressure, sensation of fullness, and a bulge. Because your pelvic organs are trying to push through the vaginal wall, a lot of the times patient will feel a little bit of fullness and heaviness, that feeling that something is coming out. And in some cases, something do come out, right? So for patients with advanced prolapse, if you look down there, they will see that there's a ball or a mass that's protruding out from the vaginal canal. Sounds scary, and if you Google images, it's even scarier to look at, but don't worry, it's not cancer. It doesn't become cancer. If you see something like that, don't get scared. Make an appointment with your gynecologist or your urogynecologist if you have one to discuss some options. Number 2, trouble emptying the bladder or the bowels. And that's because when you have prolapse that essentially feels like a ball in the vaginal canal, it's pushing against the urethra, thus blocking the bladder from emptying. And similarly, it can push against your bowels, just making it difficult for you to empty your bowel. So again, if you feel like you're perpetually having difficulty emptying the bladder, even though you feel the urge to go, something to look into. And finally, number 3, lower back and pelvic dull pain. Now, especially for patients who have uterine prolapse, where the uterus is kind of coming down and maybe all the way out into the vaginal opening, that tugging and pulling on your peritoneum, on your ligaments, can give you that sensation that is dull pressure. So that could also be a sign of pelvic organ prolapse. So bottom of the story, if you have any of these symptoms and you're not sure what's going on, time to make an appointment to see your specialist. If you found this video helpful, don't forget to put it in the comments section. And also don't forget to sign up for my newsletter for more helpful women's health tips.